Malaria remains a primary cause of illness and death for African children, and Ekiti state government says it will not leave anything to chance in a bid to kick out malaria in the state. At the World Malaria Day held in Ekiti, which has its theme Health Equity, Gender Equality and Human Rights, the State Commissioner for Health and Human Services, Dr. Oyibanji Filani, who spoke through the Permanent Secretary of the Ministry, Dr. Olushola Gbenga Igotun, noted that unwholesome practices, which include indiscriminate waste dumping and dirty environments, are factors contributing significantly to the spread of malaria in the society. The commissioner explained that government has made remarkable progress in its crusade against malaria through impact malaria programs, saying the initiative provides essential drugs and critical materials necessary to combat malaria in the state, adding that the government's focus is primarily on children and pregnant women as they are the most vulnerable to malaria.
Privileged to be under the impact malaria program in Ekiti State, which has actually helped us in the advocacy, in provision of treated nets, in provision of the drugs that our people can use. So we are actually winning the battle. And with the support of these women in advocacy and all that, I know we will definitely win.
Ekiti State Coordinator of the World Health Organization (WHO), who was represented by Dr. Adebayo Isaac, in a goodwill message identified malaria vaccines as a panacea for child health and disease control, and emphasized the need for governments to scale up efforts to ensure access to malaria vaccines for the interest of people. According to the World Health Organization official, malaria vaccines are a breakthrough for child health and malaria control.
5 countries in Africa have actually introduced malaria vaccines between 2019 and 2023, and have actually seen the impact of what these vaccines have actually done in preventing maternal and child health.
There were messages from relevant stakeholders, while pregnant women, nursing mothers, and other stakeholders were educated on means of preventing malaria. A road walked across various areas in the state capital to sensitize people about malaria prevention featured to further let the public know about the danger of malaria.